unlawful removal and misappropriation of medical equipment donated to the Ota General Hospital by Nigeria Portland Cement, popularly known as Lafarge, and Unilever Nigeria PLC, which were removed by the Honorable Commissioner for Health, Dr. Tomi, wherein we are sending a formal letter to the Executive Governor of Ogun State, Prince Dakpo Abiodun, MFRO, for the good people of Ota and its environs, in view of the global COVID-19 pandemic, which is still a major concern. Because I needed to make this point clear, well, COVID-19 is still a global concern. So they should not say because that they remove it because there's no more isolation center. So whereas the above state-of-the-art medical facility was built and also equipped by the above-named private companies and donated for the use of the Ota General Hospital, same was commissioned by this state government, with the Deputy Governor being the one who represented His Excellency, Prince Dakpo on that day of commissioning, which was done on the 24th day of November 2024. Regrettably, just about 2 months after it was commissioned and being used by the management of the Ota General Hospital for the furtherance of the health of people living in Ota and its environs, the Commissioner for Health, appointed by the same governor, Your Excellency yourself, in the person of Dr. Tomi, directed that the anesthetic machine, which has inbuilt on it ventilation equipment, as well as the dialysis machine that were donated by the above companies, were removed and taken to Abeokuta from the Ota General Hospital, where they were donated, commissioned, installed, and given for the use of the people of Ota and its environs. So, and by extension, take note that it was given to people in Ota doesn't mean it's only Ota indigenous that are going to use it. The people really working in these companies, the residents of Ota, the entire area also extending to Ifo, even to Lagos also we are using it. So, and it's also worthy to know that one of such equipment cost over 500 million. These were equipment that were not bought by the state government. Even when we had isolation centers in other aspects of the places of the state, the government did not deem it necessary to give us one Ota. But thank God for the good Samaritans that God used to provide for people of Ota. So, Your Excellency, it is on record that aside from the Ota General Hospital, COVID-19 Facility Center, which was even built and equipped by private and corporate individuals, Abeokuta and other major towns in this state also have theirs built, equipped by the state government, which we preside over. Whereas those centers and equipment in those places are still in place. In those places, which is also being controlled by the Honorable Commissioner for Health. But in her own wrong judgments and estimation, the Honorable Commissioner for Health believed that the good people of Ota and its environs do not deserve to use the state-of-the-art medical equipment. Consequent upon which, she gave a directive that the equipment bought and donated for the use of the Ota General Hospital be removed and relocated to her place of choice, just at her own discretion, thereby denying the good people of Ota and the entire local government and its environ the right to have right to life and medical treatment. And this is what we are objecting to. Our lives matters also. Believe her actions amount to corruption, maladministration, misappropriation, and outright hatred for the people who live in this locality. We therefore wish to remind Your Excellency that if this action taken by the Honorable Commissioner for Health in the person of Dr. Tomi is not reversed immediately, this would not only send a wrong message to good intentioned companies who wants to do much more for us also, but it will also scare those that have donated not to do more, and which we seriously object to. We therefore demand as follows from you, Your Excellency. One, that the Governor, Prince Dakpo Abiodun, should direct that the actions of the Commissioner for Health, to which Dr. Tomi, stated above, be reversed. And to the extent what the dialysis machine and the anesthetic machine, which were donated to Alta, strictly Alta, be returned back to Alta General Hospital. And a directive be given to her never to relocate them any further. Secondly, we direct Your Excellency, that the Honorable Commissioner for Health, Dr. Tomi be relieved of her appointment, as she no longer supports the grassroots health initiative of our amiable governor. Because if she was working in favor of this government, she would never have done what she have done. And if the governor still deem it fit to have her in her government, then that means what? The government is supporting her action. So please, for the interest of your government, let her be relieved of her office and let another person be appointed who will do better than her. And lastly, we demand that the state government should, as a matter of urgency, increase the manpower of doctors and nurses in Alta General Hospital to reflect the capacity of what this hospital entails. We are lawful people, we are lawful citizens of this great country, and we are always loyal to this government and to the state entirely well. And we would go the extra mile in exercising our legal rights to life, to health, and to good governance, ensure that our rights are not only protected, but also never to be trampled upon by anybody, inclusive of the commissioner in question. So no matter how highly placed such individuals might be. That is why we are calling upon you, Mr. Governor, do the needful. Ensure that what the above three mentioned demands are well implemented.
Health is wealth, and anything we need to do, we need to be healthy first to be able to do it. So we need this medical equipment back. They should please remember, the population in Ado-Delta is 30% of Ogun State population, and so right now we need those medical equipment. There is no other thing that we are asking for from Dr. Tomi, who removed those medical equipment, than for her to return them back to the General Hospital here in Alta. This will further encourage other well-meaning daughters and sons of Ado-Delta that wants to send other equipments to them from other countries to please be able to do so. If this is not returned, I'm sure they will not be encouraged. Our amiable governor, please do something about this situation now. Thank you.
In the first place, she said because there is no staffs to maintain this machine, that was why it was taken away. She later said they have returned it. We later discovered that the machine is still at a general hospital at Abeokuta.
The Commissioner for Health is not working for his good. Because if it's working for his good, she would have not taken that decision. So, in other words, we are calling on you, sir, to relieve this Commissioner for Health, Dr. Tomi.